On assessment of a newborn being admitted to the nursery, the nurse palpates the interior fontanelle and notes that it feels soft. The NUM determines that this finding indicates what condition? 1. Dehydration. 2. A normal finding. 3. Increased intracranial pressure. 4. Postterm by at least 2 weeks. Answer 2. Rationale. The interior fontanelle is normally 2 to 3 centimeters in width, 3 to 4 centimeters in length, and diamond-like in shape. Or can be described as soft, which is normal, or full and bulging, which could indicate increased intracranial pressure. Conversely, a depressed fontanelle could mean that the infant is dehydrated. A client admitted to the hospital with a diagnosis of pneumocystis jirovecii pneumonia is prescribed intravenous IV pertorudine. What intervention would the nurse plan to implement to safely administer the medication? 1. Infuse over 1 hour and allow client to ambulate. 2. Infuse over 1 hour with client in a supine position. 3. Administer over 30 minutes with client in a reclining position. 4. Administer by for push over 15 minutes with client in a supine position. Answer 2. Rationale. For pentamidine is an antifungal medication infused over 1 hour with the client supine to minimize severe hypotension and dysrhythmias. During the postoperative period, the client underwent a pelvic exenteration, reports pain in the calf area. What action would the nurse take? 1. Ask client to walk and observe the gait. 2. Lightly massage calf area to relieve the pain. 3. Check calf area for temperature, color, and size. 4. Administer as needed PRN morphine sulfate as prescribed for postoperative pain. Answer 3. Rationale. The nurse monitors the postoperative client for complications such as deep vein thrombosis, pulmonary emboli, and wound infection. Pain in the calf area could indicate deep vein thrombosis. Change in color, temperature, or size of the client's calf could also indicate this complication. Options 1 and 2 could cause a possible thrombosis to break loose, resulting in an embolus. The client with atrial fibrillation is prescribed sotalol AF, which assessment finding indicates that the client is experiencing an adverse effect of the medication. 1. Dry mouth. 2. Diaphoresis. 3. Difficulty swallowing. 4. Dizziness and feeling faint. Rationale. Sotalol AF is a beta-adrenergic blocking agent that may be prescribed to treat atrial fibrillation or atrial flutter. Adverse effects include headache with chest pain and severe dizziness, fainting, and fast or pounding heartbeats. Gastrointestinal disturbances, anxiety and nervousness, and unusual tiredness and weakness can also occur. The precepting nurse is supervising a new nurse's care for a client with thrombocytopenia. Which of the following actions by the new nurse would cause the preceptor to intervene? 4. Takes a piece of gauze to stop bleeding after venipuncture. Thrombocytopenia is a reduction in circulating platelets below 150 by 103, L 150 by 109 L. It is caused by low production from bone marrow suppression, destruction of platelets by autoimmune disorders, for example, thrombocytopenic purpura, or medication. Side effects, for example, heparin-induced thrombocytopenia. Thrombocytopenia increases the risk for bleeding, which may manifest as ecchymosis, petechia, or bleeding from the nose, gums, kidneys, gastrointestinal tract, or brain.